Pat and Aaron Show, 95.3 WDA and AM 620. And like we did during the middays, we loved it so much we brought it to the mornings because we've been hearing about from you, the listeners, how much you enjoy it. And if you've been to the Florida Orthopaedic Institute in partnership with Tampa General Hospital and gotten some help there recovering from an injury, nothing but the best. From what we hear about with our friends over there. And
We've heard that from so many listeners.
Yep, and that's why we have the Pat and Aaron Show Injury Report presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. And joining us as our first doctor on the new morning show, 6 to 9 Pat and Aaron Show.
And for the first time.
Is Dr. Charles Nofsinger. Good morning, Dr. Nofsinger. Thanks for joining us today.
Good morning. How are you?
Doing great. Better than some of these players dealing with injuries like Jets rookie sensation Breece Hall. The Jets have been having a really good season, and that rookie has been a big part of it with his play on the ground. He's going to miss the remainder of the season with a torn ACL. Now, doctor, for a guy that young, a rookie, what's it like as far as the recovery at that age? Does it make it any easier? And, of course, that position, you got to use your legs.
Yeah, so running back, a skilled position with an ACL tear, it's a challenge, but so Breece is obviously a stud, and one of the keys to recovery is your quadricep muscle, that big muscle in the front of your leg, and obviously he's got great quads, and he's got a good team with him there to help him recovery. In terms of how fast they recover, the fastest that it's humanly possible to come back is 6 months, and 8 months is probably what we're looking at.
So when you're talking about that ACL, it's the type of thing that, years ago, and I know I'm not telling you anything you don't know, but it used to be such a game changer for guys. It would end their careers. It would really hamper their careers. We're at a point now where, like you were just talking about, guys come back much quicker from that injury. And a lot of times, even though it still takes a year or so sometimes for guys to get back to where they were, they come back just as good. Are we at a point now where that's just an expectation that an ACL isn't going to end your career, isn't going to really hamper you, but that within a year or two you are going to be back to normal, which, again, wasn't always the case?
No, I totally agree with you. I think if in the right situation, so let's say, I don't know, obviously the details of the MRI, which was what you'd get if you had tore your ACL on Breece, but if he does not have cartilage damage, the chance that he gets back is extremely high. And we have new technologies that we're using these days to both protect the ACL while you're coming back and also when you recover. We have this new thing that it's like a tourniquet, but it helps the muscle come back faster. So those two things are making a big difference too.
DK Metcalf, speaking of a different leg injury, he suffered a patellar tendon injury. He will not require surgery. When you get an injury like that, how do you determine whether or not surgery is needed and what the extent of that injury is?
Yeah, it's a great question. So the patellar tendon, that thing between your kneecap and that bone below it, the tibia, that tendon is injured in people that jump and push off a lot. And the way we figure it out is first, obviously, we examine them, right, and see what it looks like. And then the next thing would be an MRI, and the MRI will show us how torn it is. Sometimes it's partially torn, and sometimes it's completely torn. In a partial tear, many times you can get back without surgery.
Dr. Charles Nofsinger joining us right now from the Florida Orthopaedic Institute. Doc, I know this is your first time with us. We didn't include this question in the prep, but we always want to make sure we ask the most important things during these interviews.
Sure.
We saw a report, and there were some quotes from Russel Wilson that he's only allowing himself to poop twice a week now, and it's part of his diet. And part of what he said was having the extra waste from not pooping after Thursday, because he says he only poops on Tuesdays and Thursday. He says having the extra waste inside him helps protect him against the impact from that when he takes hits on Sunday. Will it? If you're full of crap, will it help you when you take a big hit?
Or is he just full of crap?
Yeah, right.
Being full of crap may help you when you're chatting with your buddies, but it's not going to help you on the football field.
I don't know where he gets these things
it's really
from.
Weird.
It is very strange.
Yeah, I don't know. It's one of those bizarre theories, but no, it's not going to help you.
Yeah, we were also talking about another curveball at you. By the way, you knocked that one out of the park. Carlton Davis of the Buccaneers, he's dealing with a hip injury, and from his position, a guy who's defending receivers and has to make those type of movements with his hips. How a recovery, and what's that hip injury like any hip injury, and recovering from that?
Yeah, so hip injuries in the NFL, a lot of times there are these muscles on the inside of your leg that help you pull your legs together called the adductors. And those things can be a real pain in the tail, like literally. And, it has a lot to do with the athletic trainer and how they get the guy back. And it has a lot to do, honestly, with the player's mentality. You got to play with pain and be just ready to be out there putting it down with pain. That's those injuries are about. And then in the off season, if you had to, you could go after it with some kind of a procedure.
So if you speak to aging people with hip issues, they will tell you that, a lot of them will tell you that they kind of don't get better and they're always kind of lingering and they're always kind of around. Is this the type of thing, even though obviously it's not an aging issue, we're talking about a young player and a great athlete, but is this the type of thing that will also linger and kind of be difficult to get rid of over the course of the season? Or, like you said, is it the kind of thing where you just got to wait till the offseason to really get it right?
Yeah, during the season it's going to hurt, period. That's the way these things are. In the off-season, many times you can get it back to normal. Sometimes I'm not sure if you guys have heard of this thing called sports hernia, where you actually rip the tendon off the bone, and then that takes a surgery. But the recovery is pretty remarkable. So, he's going to have it in the season, and like you said, in the off season, you should get over it.
What does the sports hernia feel like? Because Doc,
here we go.
Just hear me out, Doc.
Here we go.
I was rounding second base last night during my softball game, and I just felt a little bit in the left side little area, and I was like, I think I've completely torn it. Would I not be able to move?
Nah, sports hernia, so what it is those muscles in the front of your abdomen, that rectus. So if you got like a six-pack, right, and then the muscle thing that pulls. So if you got that, hold on a second.
Are you checking your abs, Doc?
When those, I know. When those two things pull at the same time, it can rip the tendon off the bone. So a sports hernia is kind of a unique kind of pain that, it travels down into your testicles and it's brutal. So unless you have that kind of pain, it's probably not a sports hernia.
Number two,
the boys
testicles.
Okay, Aaron?
I feel good now. And Dr. Charles Nofsinger, I got to say, we could tell right away. Pat and I gave each other a look. It's the first time you've been on the show. We knew right from the first sentence that you're fantastic. You will certainly be on the show again. We really enjoyed you today, Dr. Nofsinger.
That's awesome.
Hey,
thanks, Doc.
Thank you so much. And once again, the Pat and Aaron Show Injury Report presented by Tampa General Hospital in partnership with Florida Orthopaedic Institute. They provide you with access to one of the top orthopedic programs in the nation. Schedule an appointment today at floridaortho.com. And one of the things I really love about them, Pat, is, sometimes you get doctors that are stale. We have had so many doctors on from there that are just normal. Like, I would feel comfortable if I'm dealing with an injury where I have to go get surgery potentially, and that's nerve-wracking to have people there that can calm you down, can joke around a little bit. I love everyone over there.
Bedside manner is very important, and you can tell, like you said, by the doctors that we have on that they know what they're doing.